What is the connection between incurable spreading eczema and topical steroid use?
It's a common question, and it's totally understandable. How can you say, Rappaport, that this is steroids when it looks like eczema? Says the doctors, says the patients. The best I can come up with as a logical explanation is that the natural history of eczema is that it burns out by teen years usually, in 99 or more percent, period. Oh, wait a second, says the derm now. What do you mean? I see tons of people who have bad eczema, and I'm saying they're not eczema people, they're steroid people, steroid addicted people. How do you know that? Because the natural history before the advent of the super potent topical corticosteroids was that it burned out. You, young doctor, young, between 1 and 30 years in practice, have only seen the worst eczematous-like patients who have been on steroids for a very long period of time. You've never seen a pure eczema patient in your life. So you cannot fathom that this is indeed, it looks the same, it's different. And then the best I can say is, in corroboration, there's scientific evidence. When you look at the patient, their blood vessels dilate, they're red, with maybe a little patch of eczema, or maybe not. Well, eczema doesn't have dilated blood vessels, but these atopic individuals do, and steroids love to close vessels down, and then they rebound and open up, and they're burning and itching and hurting all over. And they put more on, or they take pills to calm it down. And the scientific proof is that the testing of steroids in the pre-marketing company arena, you put a certain amount on the forearm, you tape it, I forget how it's done exactly, you come back a half hour later and you look for a whitening effect, and you measure the distance of the whitening effect, because steroids closes vessels down and it whitens. The weak ones whiten for a half an inch, and the strong ones whiten for 2 inches. That's why they're called strong, and the others are called weak. So the same thing that identifies the strength of a steroid is happening to the patients on a daily basis with this endless overusage.
When and how did you discover topical steroid addiction?
I ran a clinic at UCLA years ago. It was called a contact dermatitis clinic and photodermatitis clinic. I was interested in sunlight problems and allergies. We saw referrals from all over Southern California with worsening or non-healing eczematous rashes, especially on the face. And we were asked to evaluate them. We did patch testing, we did biopsy, we did blood tests, we did all kinds of things. And we came up with nothing. And all I could get, the only positive was the history was always the same. A little eyelid rash, and then a year later, after putting steroids on for a year, the whole face is involved, and they ran out of the tube of cream, and it spread to their upper chest, etc., etc., etc. And I said, oh, it's the therapy, probably, because there's nothing else to explain why they're having ongoing problems. We did light testing with special lights to see if they're allergic, if they have lupus. Nothing ever, ever, ever. So it was steroids. Very hard sell to the referring doc. Your therapy, sir, is causing the problem. Stop the therapy, patient will get better. No, very hard to understand, very difficult. But finally, after more people and more patients, and I wrote papers and I gave lectures, the word got out, and there were some who believed. And for sure the patients, most recently in the last 10 years, found the papers on the internet and started bugging their doctors or coming in to see me. And by now I've seen about 2,000 patients, all the same. Same history, same look, same everything. And by now, the vast majority are cured. It's been enough time. And I'm sorry to say it takes a long time to cure them. Months to years. No special therapy, nothing. And they're perfectly normal after the cure sets in. They never see me again. They never see another doctor again for this. It's over with.
What would you say are the top symptoms to know whether you have eczema versus topical steroid addiction?
Well, eczema people itch. Eczema people itch fiercely, and they get a little bit of redness. The steroid-addicted people burn. They're on fire. Eczema people are never on fire, never burn. And the burning is because the vessels dilate, and it causes a burning sensation. To me, that's the tip-off, instantly almost, without even pursuing it further with more history.
How much steroid use does it take to cause topical steroid addiction?
Weeks to months. But if they're using super potent steroids, it can be a short period of time, just weeks. Certain locations suck in the steroid more and their vessels react faster, like the eyelids, the groin, the armpits. So they get into trouble more readily and quicker.
How do I stop my addiction to topical steroids?
In many situations, long-term steroid usage in lupus people, rheumatoid arthritis people, other problems, the doctors in their wisdom taper the patients down for fear that the adrenal gland won't kick in. Those are oral steroids, systemic steroids. With these patients, because it's a vascular problem, every time you try to taper down, they just flare on you again. Give them a weaker one, take a little bit away from them, go every other day, they start flaring. So it dawned on me years ago, cold turkey is the only way. And as they go through the hell, we hold their hand through it, and finally there's a break, and they do okay.
What is the cure for topical steroid addiction?
Total cessation. And it's like every other addiction. I mean, how do you treat the morphine addict? You cold turkey him. And for a year, he's got seizures, he's nervous, he's anxious, he fiddles, he has tremors. You treat those things, those side effects.
Does everyone really become cured over time?
Absolute across the board.
Does the eczema come back once it's been cured?
You might itch on the leg in the wintertime. You might get a little rash. So you treat it with creams or lubrication, and usually that's sufficient without running to the steroid right away. I have, with some people, tried 5-10 years later a little bit of steroid on the leg when they had a facial rash. And I've gotten away with it about 50% of the time. The other 50, they clear, and then the next week they rebound locally, and I say no more steroids.
What are the most typical symptoms of topical steroid withdrawal?
Well, initially, let's talk about the worst patients because they exemplify all these symptoms. The worst because the vessels open up, they pour fluid out, so they get swollen and edematous. They could have a swollen face like a cantaloupe, and finally when the edema is absorbed 4 or 5 months later, they look at themselves, I've lost weight, it was all fluid. Or the vessels open up and they pour fluid outside of the skin, so they ooze and they get wet. And again, in the wrong hands, the wrong doctor diagnosis, they think it's infected when it's not. It's just pure, normal fluid, just dry it up with, we have a couple of tricks to dry it up.
When the skin is itching and burning during withdrawal, does that mean I have an infection?
Rarely, rarely, rarely. We watch, but everything red and everything ooze is not infection. And in taking the history of all of the people when they finally get here, all of them have been put on antibiotics when they ooze a little bit or when they get a little red. Everyone across the board. And you say to them, did you get better? No. No.
Can a patient use any type of topical steroid, either over the counter or from the doctor, to help with the withdrawal symptoms?
It's all nothing. You cannot. It just instigates the problem all over again. I've done it with people who have cured. And give me 5-10 years. Get a little, let's see, because the experience is that they rebound. I don't want them to go through a problem again.
What if a patient is using another type of steroid to treat an illness such as asthma?
Well, all steroids probably are cumulative, but if you need it, the inhaler to live, we'll cross that bridge. If you have a bad knee and they want to give you a shot, if you don't really need the shot, I'd like to talk the orthopod out of not doing it. If it's really necessary, we do it. And we live with a flare if you flare. Don't worry about it.
What recommendations do you have to make the topical steroid withdrawal go more smoothly?
Well, when they're really terrible and they're covered from head to toe, I've used the immunosuppressive drug cyclosporin. We have some people who I just push in the bathtub for days on end just to cool that skin down. Some people who are horrible have to drop out of school or work. The vast majority are able to function, and we support them. The panic that they all have gone through with all the other docs, I try to allay that with talk, telephone, email, visits, because they're worried. They're always worried. And I say, I've seen it. Don't worry about it. It'll be better in 2 days. And when I'm right, they go along with what I say for the next time. But it's the personality of the patient and the premorbid personality.
What moisturizers do you recommend to your patients while they're going through withdrawal?
I always ask the patient what they like. Usually they'll tell me they like, Aveeno or Curel or something. I say, you like it? It's not causing any trouble, do it. I like a couple ones here that we've brought on board. They're different. They imply a little different approach than something over the counter in the drugstore. And so far, nobody's been bothered. We use a thing called Egyptian Magic and one called Preen. And they're very effective and safe.
Many patients experience a very intense itch during the withdrawal. What causes that specific type of itch?
Eczema itches. The burning is on a neurological basis, probably. It's dilated blood vessels, but the small little nerves in the skin are reacting. And itching is carried by the small little nerves in the skin. So one kicks off the other. The redness can be gone and they're fiercely itching still, but the itching will stop. You can be fiercely red and no itching. You can be fiercely red and itch. All parameters are evident, but sooner or later they all go away. And we get them to sleep with a sleeping pill. We give them anti-itch pills. We have anti-burning medicine called Neurontin. We have anti-anxiety medicine. We have me talking on the telephone, giving supportive therapy. Those are the therapies that work.
Why will a patient experience withdrawal symptoms on other parts of their body where they never applied the topical steroids in the first place?
The steroids were absorbed through the body, and that's why, let's just say the first patients we wrote the paper about had eyelid rashes. I wrote up 100 eyelid dermatitis patients. I have pictures when they ceased the steroids down to their upper chest. How the heck could steroids being rubbed on the eyelids cause a problem down here? It does. The steroids are absorbed and affect the vessels within 6 feet, 6 inches, 12 inches. So, and patients don't remember. You've been putting steroids on for 20 years. Did you ever put them on your right ankle? No. Well, how do you remember? But it's really the absorption through the body, and it goes all over the place.
I'm traumatized, I'm paralyzed, I'm giving up on hope. And I'm getting high, and I'm coming down harder every time. I'm kicking sand, and I'm wasting time. I'll try, but I can't cope. And I'm terrified that I'm coming down harder every time. You say